Hi viewers, greetings to you. I am Father Nathan from the Lord's Nest YouTube. I'm happy to introduce to you this morning a well-known, popular doctor. Here are a few profile tips about him so that you would know with whom I am talking to. Dr. Gilbert Joseph, MS General Surgeon, MS MCH Cardiothoracic Surgeon and Senior Consultant Cardiothoracic Surgeon with 28 years experience, MBBS St. John's Medical College Hospital, MS and many more things as you would listen to him. He has been in Australia, he has been in Nigeria, he has been in Bahrain, having a very elaborate and comprehensive experience about his medical service towards health issues of the people who have heart problems. Here we introduce to you him so that he will give you some tips for your heart ailment. Many of us, particularly in our Indian populace, millions and millions of people are suffering from heart issues, irrespective of age and other sector. Here we have Dr. Gilbert Joseph. Good morning, Doctor.
Good morning, Father Nathan.
We heard much about you, your service, and you're working here in Snehadan Hospital, Karmalaram. And our YouTube viewers are very much interested in listening to you because as I heard and as I interacted with you for a long time, I found myself you are a very wonderful, resourceful person towards the people who have a lot of problems with regard to their health. Could you kindly brief to them what are you doing, how to bring remedies to those people who have regular, irregular heart issues? What exactly the heart issues? Why people undergo surgeries or lot of medicines and lot of issues, both diabetes or hypertension and other related issues? Could you kindly talk to us?
Thank you, Father. As Father said, I've got a lot of experience in treating cardiothoracic ailments and cardiothoracic. I've been a cardiothoracic surgeon for a long time now, more than 28 years. And what I have noticed in India, in our subcontinent, is the amount of people who are having heart disease is in epidemic proportion. And in fact, there's a terminology now what we call non-communicable diseases, which we call NSIDS. This is the most important thing because this is the cause of highest mortality in our country. It is not tuberculosis, it's not infectious diseases. And the other alarming thing is most of this heart disease who have atherosclerosis and heart attack are occurring in younger age group. And you would have seen a lot of people having sudden heart failure and people undergoing treatment like stenting and CABGs and bypass and things like that. But my take is there are a lot of things we have to do for prevention of heart disease, and there are some very few tips, general tips, which will help you and which will definitely decrease your incidence of heart disease. And if you do have a heart disease, it will also arrest the progression of the heart disease. And this is what I want to elaborate. Now there are about 3 or 4 points you need to understand. The most important thing is what is the source of your energy, what we call food. It has to be a balanced diet. Balanced diet means that you should eat enough carbohydrates, enough fats, enough proteins and minerals and drink a lot of water. Anything in excess is bad. You see, you need a source. So you need to have a balanced diet. That is the most important thing. The second most important thing after you have a balanced diet is you also have to have some kind of activity, which is most important. Activity, what I meant by activity is not to go to a gym or lift weights or do some activities where you spend a lot of money. The simplest solution for that is walking. Brisk walking for half an hour, 30 minutes a day or 150 minutes per week has been shown all over the world and has been recommended by all specialists is what causes decrease in mortality and morbidity of heart disease. So important thing is have a balanced diet. Second thing is brisk walking for half an hour or 150 minutes per week, which means that even if you walk for 5 days a week, brisk walking is good enough. The third thing which you need to understand is sleep. Many people don't tell you about sleep. The normal body has to rest from after you have done your work or you come back. You should have at least 8 hours of sleep. In this hustle bustle of our tension and stresses, we lose sleep. Now this causes also problems to your heart and to your body because it increases the inflammatory response, which is directly responsible for heart disease. So these three things are very important: food, source, balanced diet, exercise, and good sleep. Now you will say, what about people who have diabetes, who are people who have hypertension, and people who have had treatment like high cholesterol? Now what do we do for those patients? Now if you look at what I have said, balanced diet itself will treat you. If you are a diabetic, reduce your carbohydrate, reduce your calorie intake. That is the most important. So if you have a balanced diet, you already got calorie restriction. Reduce your sugar consumption. If you are a hypertensive, high blood pressure, reduce your salt intake, like in pickles, in chips, where you eat a lot of salt. You reduce that, your blood pressure will come down. Now apart from these two things, your cholesterol levels will come down if you eat less of fatty foods, less of fried foods. Now there is another alarming thing which I also do research, and I found these vegetable oils which are sold in the markets. These are produced to increase shelf life. That means they have to be present for 90 days or 3 months. They contain something called trans fats, which is what I have found. A lot of oils which are healthy have got lot of trans fat. Now according to the WHO and our hospital directories, we should have less than 2.5% of trans fat. Now the best way to have oil, whatever oil you have, whether it is groundnut oil, sunflower oil, the best oil what I find is if you do cold compressed oil and use that cold compressed oil, you will eliminate trans fat absolutely. In fact, the WHO has said that the trans fat has to be zero, because trans fat has been shown to cause diabetes, hypertension, heart disease, dementia, and cancers. So by balanced diet, you have reduced it, and by exercise, you have made your body mass index, what we call BMI, come into a normal range. You see, you got two things you have done. And if you are a diabetic and hypertensive, medications also will help you to reduce the control.
Thank you so much, doctor, for beautifully explaining about the heart issues and the remedies and how to overcome all such things. Only one question. These days, people and youngsters are very much busy with IT world and as you said, hustle bustle world, running about and driving about, riding about to look for earning and so on, and coming back home and sleeping late, not eating time and food on time and so on, and that causes a stress. What is a stress? Why stress causes heart issues? How they are related?
Thank you. I will tell you something about stress. See, people mistake stress as abnormal. You see, a stress, like suppose let me give you an example. If you see a snake, your heart will start beating very fast, and you will either flee or you will take some action to prevent yourself bitten. Now this is a normal reaction. Now when this happens, the heart rate races. In your blood there are a lot of chemicals put in called cortisol. These are called stress hormones, but they are supposed to last for a few seconds and for a few minutes. You see, the body prepares you to flee or to fight. This is a normal response. This is what the stress response. This is the stress response. You need the stress response to navigate in the world. Okay, now what has happened in today's modern society is we have made our bodies to be slaves. You see, you go to work, you get up at 6, you commute to work, you have a lot of traffic issues, and when you go to work you have a lot of work issues.
Some get up even at 3 o'clock.
Yes,
because of the heavy traffic in order to avoid, and they get up at 3 o'clock and come back late at 10, 11 and all.
yes.
You know?
So you see, your body has developed evolution over millions of years. You see, you need to have a balanced diet. You need to have a diet because the source is your energy. Now when you take in energy, the energy has to be used for what we call basal rate, that is for breathing, seeing, hearing. Now that's your basal. Now the next rate which you use is for active purpose, like you're sleeping, walking, talking, listening, consciously, cognitively using in your work. So that also requires energy. You see, now when you have basal rate and active rate, after that the source of energy which you're taking has to be stored, because you don't eat all the time, you eat only 3 meals. So that has to be stored and then they come out. Now the problem with modern society is we eat not in a balanced way, we eat irregularly, and the other thing is your body is functioning all the time. Your heart is beating from the day you were born, when cells are formed, till you die your heart is beating. Your brain is functioning even while during sleep. They all require energy, but the body still needs to take rest, and it has been found that 8 hours of sleep is a necessity. And believe me, every living creature on earth sleeps. Every living creature. So evolution has created sleep for a reason, and therefore the stress response what I'm talking about, you can imagine, if you don't sleep properly, your body thinks there is a fear, there is something happening. If you go to work and you're stressed out, you come and commute, you come back late, you don't have your meals, you're again stressed out. Now these hormones are not lasting for seconds or minutes, but they're lasting for hours, and over a lifetime, 10 years, 20 years. And that is the reason why you're getting heart disease, which is caused by inflammatory disease, diabetes, hypertension, and you have a lot of mortality. Apart from that, even psychiatric illness like anxiety, depression, and these are all what causes the young people to develop these things.
Great, doctor. And the last question would be for those people who have undergone angioplasty in young age, middle-aged or even later, and how they should keep up, or how should they protect their heart from the other forthcoming problems of the heart. Could you tell us those angioplasty patients or those who are undergoing such plasty issues?
Yeah, thank you. See, what you have to understand is when you undergo an angioplasty, a stent or a bypass grafting or a valve replacement, you have to understand the patient who undergoes this is not being cured. What he has got is, he has got an additional lifespan attached to it because we have extended the life. Okay, we have not cured the patient. What I meant by cured is what caused your block, what caused the heart problem is with you and remains with you. You see, now there are 5 risk factors which we always tell. One is diabetes, hypertension, smoking, cholesterol, and less activity. Now these 5 things, and the congenital where you have acquired it from your parents, now that is not controllable. Now these 5 things which we talk about is in your hands. So whatever procedure you undergo, if you eat a balanced diet, if you control your diabetes, if you control your hypertension, and you stop smoking, smoking has absolutely no benefit at all. Okay, and activity is very simple. If you just walk for half an hour or 150 minutes, you've got your quota. You see, all these 5 things you should do, and the medications which your prescription, your physician or your surgeon gives to protect the heart has to be taken. Like for example, aspirin and clopidogrel. These are antiplatelet drugs given so that your stent or your bypassed vessel do not get blocked. Why do we give that? Is because whatever caused the block remains with you. So we control that. So you have to take those medications. Otherwise, you can go into having a block.
Thank you so much, Dr. Gilbert Joseph. You have explained very beautifully and understandable way, intelligible way,
Thank you.
how the heart patients are undergoing these days and why the youngsters are inflicted by these sort of issues. And you have brought out very beautifully how they should prevent heart issues, and if those who have heart issues, how they should maintain with it and carry on. And you are given a lot of tips, and you are here visiting doctor in Snehadan, Karmalaram, one of the mushrooming beautiful hospitals in Bangalore city, in Sarjapur Road, Snehadan Hospital. You can visit now and then. Doctor is available every Thursday, and he also in St. John's Hospital.
No, I used to work in St. John's a long time back. Now I am working as a visiting consultant in many other hospitals. Okay.
Yes.
And I also operate cardiac surgery, and I also see a lot of patients and advise them on heart issues and post-operative patients, and also help people in controlling their risk factors.
Compared to doctors, I observed in him a lot of explanation about he doesn't much deal with remedies alone, but root cause. He goes why you have such a problem, why you have this issue. Very beautiful consultation. Please visit Snehadan, Karmalaram, okay, hospital here. And I wish to thank on behalf of our viewers, the Lord's Nest viewers. Thank you so much, Dr. Gilbert Joseph, for your fantastic explanation and your time spent for our YouTube world. Thank you.
Thank you, Father.
God bless
Thank
you.
Thank you.